Every day in the UK, 14 babies are stillborn or die soon after birth, and many more pregnancies end in miscarriage before 24 weeks. The loss of a baby has a profound impact on families and leaves many parents with questions about why their baby died. To try to find out why this happened, parents are usually offered a post-mortem investigation, also called an autopsy. The autopsy tries to provide answers about why the pregnancy ended and whether it might happen again. In most cases, an autopsy can only be carried out with the parents' consent. Part of that consent is choosing what kind of autopsy they agree to. There are different kinds of autopsy. The most common is a standard or full autopsy. A specialist doctor, called a pathologist, examines the baby and the placenta and takes blood and tissue samples. Normally, an incision in the baby's chest is required to examine these organs. Parents often tell us that they find the idea of cutting into their baby's body too much and feel their baby has been through enough already. To address this, we've developed imaging techniques to perform an examination without an incision, called a non-invasive imaging autopsy. These include using X-rays, CT scans, MRI, ultrasound, and a new technique called micro-CT that can be used for very small babies. In our experience, imaging tells parents what caused the baby's death in about half of all cases, or reassures them and us that the baby was normal. Sometimes imaging isn't enough, and organ samples are needed. We can now do this through much smaller incisions to the body, similar to keyhole surgery. This is called a minimally invasive autopsy. We know that parents have different views about what investigations are acceptable to them. Most importantly, parents need to be able to choose the investigation they feel most comfortable with.
I think it's great that parents have a choice of options at a time when so much control has been taken away from them.
Having a range of options for parents to choose from means that more parents overall will choose to have some form of autopsy.
If a less invasive procedure had been available, we might have accepted an autopsy after our baby died, but it wasn't offered to us, so we declined.
Here at Great Ormond Street Hospital, we've been working hard to develop and evaluate new autopsy techniques. We want to find out which ones work best and in which circumstances. Our approach of doing the minimum necessary aims to provide a better service for all parents during this difficult time.